Okay, enough from me. Let me introduce our first speaker, our first panel. I've had the pleasure of working with Camille Tutti. I'm sure many of you know Camille. She is a journalist that is renowned in this market, working on some terrific websites and publications. She's the editor-in-chief of what we're doing at Government CIO Media and is just doing an outstanding job. One of the things that we've talked about internally is we don't want to be the same as everybody else. We want to have two major differentiations. One is the content that we put up is going to be different than what the other websites put up, and how we put up that content is different. So you'll see a lot of video, you'll see a lot of animation, you'll see a lot of graphics on our website. And I attributed so much of that to Camille Tutti. So please join me in welcoming Camille Tutti. I know you have to sort of make your way around there. There you go.
Well, thank you so much, Steve. I want to encourage you to use the hashtag Uncle Sam Innovates. So don't put away your phones. Make sure to take lots of pictures. This is such a beautiful venue, so I'm sure you all want to share it in beautiful weather as well. So thank you all for coming here. Like Steve said, innovation is one of the main areas of focus for the federal government, and it has been for the past few years. So we're really going to dive deeper into agency use cases and talk with these innovators about how they were able to make innovation happen. It's not easy, but it's not impossible. So I would like to bring up my first panel. We have Kevin McTigue and Dr. Mona Siddiqui from HHS. So please come up here. So I'm going to sit here. Yeah, it's a little weird. All right. So thank you both for coming here and partaking in this event. We are really happy to have you both and everyone else as well. So I'd like you to start by giving me a 30-second elevator pitch on who you are and what you do. So let's start with Kevin.
Sure, thank you. Can you hear me? Oh, there it is. So I'm the so Kevin McTigue, I'm the director of the HHS Idea Lab. We sit in the immediate office of the Secretary at HHS, and we have a unique opportunity to view the cross-collaboration needs and opportunities throughout the department of HHS. So I run a suite of programming that is intended to both build the capacity in the workforce to enable more modern practices, so things like design thinking or lean startup or agile execution practices. And I also, in effect, beyond building workforce capacity, also help deliver on projects, some of which we'll probably get into in a few minutes.
Dr. Siddiqui.
Good morning. And by the way, a beautiful venue. I just came from HIMSS and stuck in Vegas for 4 days inside a not, DC waterside building. This is a fantastic way to start the day. So I'm the Chief Data Officer for the Department of Health and Human Services. It's a fairly new position, although the portfolio is not new. As many of you likely know, in the last administration, we released over 1,500 data sets for public use for both entrepreneurs and for researchers. Really after that, the question was, how are we using data internally for better decision making, for evidence-based policy, for resource allocation? It turns out not so well. As you know, HHS is not a single organization, but a federation of many different agencies, including CDC, CMS, FDA, and others. And there isn't really a way that currently exists that's transparent for how data gets shared and how data gets used beyond the primary reporting purpose of a data collection activity. So my job really is to create a structure for the entire department to begin to use data for evidence-based policy making. That entails really building a governance structure for HHS around the people, processes, technology needed to have a data sharing process in place. It involves taking a look at the legal framing for how data gets shared currently, and we can talk a little bit about the challenges around that, as well as building an analytics capacity for the department to really feed into the business side of running an organization like HHS, and partnerships around data. So we know that we likely don't have all the data that we would want to have, and that we will need partnerships with other federal departments and with private sector companies to bring data in to HHS that we can start to leverage again for better decision making.
So I want to start by asking both of you, what are the biggest challenges you're trying to solve with innovation? So Kevin?
Yeah, so this is going to be a little abstract, but effectively any large organization, whether it's public sector or commercial sector, is intended to build and run like a machine. It's intended to yield KPIs in known processes. And I am trying to attempt to build a workforce to respond to unknown unknowns. So the biggest challenges for me is to find my team of doers and those who are willing to buy in and really scale the capacity of our 80,000 professional staff members at HHS across all of our federal agencies to enable a mission, whether it's healthcare delivery or the value agenda of healthcare or regulatory science or translational research science or public health interventions in a more nimble way that going from an 18-month timeline to something to a 2 or 3 week timeline to execute our mission.
There has been really a lack of evidence-based decision-making, and I think the biggest change is really a cultural shift in how data gets viewed. I think we talk about data in the abstract, really, and not tie it to the business of running an organization and the value that is potentially created from using data. So I think that's challenge number one. I would say number two really is, it's a bit more into the weeds. It's each agency operates within its own statutory authorities. Each set of data has its own regs and sometimes its own statutes that it's constrained by. And so looking at, even within the HHS family, how can you reconcile some of the legal issues so that SAMHSA and HRSA can share data with each other, even though they might be operating within different statutory authorities. And so the challenge of an outside user, outside of HHS, using data internal to HHS, those challenges are sometimes exactly analogous to the challenges that HHS staff face in sharing data, which is, I think, a really surprising and frustrating piece of the landscape.
So how has the explosion of data changed your role? You've been a CDO now at HHS for almost a year, I believe. So how has that deluge of data and the availability of data and having that availability to open up data, how has that changed how you work?
Yeah, so again, people talk about data in the abstract a lot, and we throw around a lot of different words. But at the end of the day, what I really want to be able to show is how you create value from that data. And so we are looking at use cases like, for instance, the opioid epidemic and how we can start to leverage data from across HHS to move the needle for how we address that epidemic, both from a perspective of how we think about resources and partnering with states, as well as looking at policies that we've historically had and how we can start to reframe some of that conversation.
And, there's innovation for the sake of innovation, but what you're doing is actually saving lives. So can you talk a little bit about the Opioid Codeathon that HHS did? Because that's literally trying to save lives with innovation.
Absolutely. So The Opioid Codeathon we had in December, and it really served three purposes in my mind. The first was, of course, to shine a light on the epidemic itself and the department's commitment to advancing solutions. The second was to show really both the department leadership and staff what is possible with data. So unless you're embedded in this space, data does not mean a lot. And I think it was really great to be able to give people a visual for what it is that we mean when we say data can be used for solutions. And to see 250 people coding for 2 days and 1 night, and Kevin actually stayed overnight to help us manage all of those people. 250 people coding. The HHS secretary stopped by multiple times, staff stopped by multiple times, really curious around what is it that all of these people are doing with HHS data. So I think that was a really fantastic visual for people to start to understand that data is not something that you just collect and then store, but can actually be used for solutions. And then the third piece was really for us to understand what are some of the legal, technical, and cultural barriers to data sharing that HHS faces, and there was a sprint for our team to get a better understanding of that. But the Codeathon really placed, I think data was the star of the show. We had 70 data assets from across HHS, from 7 different states, and from Department of Justice, Department of Education, the Census Bureau, and a few other departments, which was fantastic. So it was a real coming together.
I know that one team came up with a tool to track overdoses. Can you talk a little bit about what the teams came up with?
Yeah, so the teams came up with really a variety of solutions, from being able to track pills that have not been used and provide a mechanism to return those to pharmacies, to being able to provide physicians a tool by which they can start to look at their own prescribing patterns. So it was really, we had asked for solutions in 3 buckets. One, prevention, the other was treatment, and the third was understanding usage. And so we had a solution in each of those tracks. And if you go to hhs.gov/challenges, you'll be able to get a good description of the 3 winning teams. And they're continuing actually to work on their products, which is, I think, a great testament to the event itself.
And Kevin, when you and I talked prior in our panel prep call, you mentioned, when I asked what is your approach to technologies, you said you have more of a cautious approach to emerging technologies or new technologies. Can you elaborate a little bit on that?
Yeah, sure thing. So our office, the Chief Technology Office, has been standing since 2008, 2009. And during the early years, there was an approach to evangelize technologies for the early adopters within our workforce. Now I think it's important to institutionalize the way that we either procure emerging technologies or that we broadly adopt emerging technologies. And so we have to recognize that the echo chambers of the skinny jeans and translucent wireframe glasses is no longer just the audience within our own workforce that we're trying to win over. We need to win over the audience within our own workforce that, in fact, are those decision makers with 20 plus years of experience.
And there's another effort called the HHS Startup Days, which aims to open the doors to the startup and entrepreneur community. Can you talk a little bit about that?
Yeah, thanks. So the HHS Startup Day came about because we recognized that there was an opportunity to best serve the American people through integrative solutions with companies that can really help us drive value. We've also recognized that it's hard for startups who have found, let's say even scale-ups, right, who have found commercial fit. You're talking Silicon Valley, Boston, Austin, whatever your favorite tech hub is, with the best venture capital and the best brands out there. They've yet to find their fit into the .gov landscape. And so we want to help those kinds of companies that can drive value for the American people and effectively our customers best engage with HHS. So if that includes finding a way to go to market through, with HHS. We'd like to be, your genius bar, for lack of a better word. If that includes learning about the FDA regulatory landscape to go to market through HHS, or how Medicare reimburses, or how CDC data sets can improve product quality of your web app, we'd love to engage you as well. So we recognize that there are existing efforts, but we hope that we can really scale this effort. So we started in Washington, D.C. here this past February, and we're going around the country, and we'll be in Boston in just a couple weeks, and then Atlanta and Chicago and Charlotte and Houston, and really wherever anybody wants to host us. So feel free to talk to me about it afterwards.
So in the future, what do you think will be the biggest hurdle to HHS continued effort to innovate?
You want to? So I keep harping on it, but we have a workforce of 80,000 people. I think there are many folks in our community that say, I am the leader in this, and I am the best at what I do. And my aim is to come at this from a servant leadership role in terms of recognizing that I can shepherd those that are excited and build a coalition of the willing. And so again, regardless if it's public sector or commercial sector, a large organization is intentionally built to execute existing known processes. And innovation is clearly a path to validated learning. And so we have to gain buy-in from professionals at the variety of the ranks and enable incentives within our workforce to perform in a modern, nimble way that yields the best approach and best value for our citizens.
Yeah, I would say, one of the biggest challenges for any organization that's as large as HHS is running an effective and efficient operation. And I see this as a challenge not just for HHS, but for any large organization. And it's interesting. I think data is often seen as something separate from the operation side. I think that increasingly that is going to be changing, and the data piece is going to be embedded in how an organization operates on a day-to-day basis. And we are just on the starting leg of a journey. I think that is that has the possibility of really transforming the way that the department operates in the next 15 to 20 years.
Something that's been mentioned over and over again, Steve mentioned it in his remarks, is that partnerships are very important. And so how are you continuing to cultivate those relationships with the entrepreneurial community, the private sector, and commercial partners?
So I'll just say one thing. When I was looking at our data portfolio and bringing in a company to work with us, the one thing I realized fairly quickly was that a lot of the usual suspects, the bigger names, were not the companies that could really address the needs of the portfolio. And so the company that I brought in eventually was new to the federal government.
So what was that? Why weren't they able to?
I think, so in this space, you can tell when somebody is trying to address all your problems and thus will address none. And so, I was looking for a very specific set of skills and experiences, and really had to do my due diligence in looking at some of the smaller companies that perhaps had experience in the private sector and experience in the commercial market, but not necessarily in the federal space, which was fine because they've worked with really large, complicated organizations. And so we figured out, that this was the right expertise. But I think it does take time. I think our office is really unique in that we do understand the value that some of these smaller companies and startups bring, as Kevin said, and do try to partner with them. So that was really, I can say we've actually done that, and it is one of the biggest projects that is currently happening at HHS, and one of the most visible projects. So I think for us to have brought in a company that had, not as much experience in the federal space, I think really says a lot for the department and for the office.
Kevin, do you want to add?
Sure. So GovTech investment in terms of an investment thesis is quite small relative to the broader investor community. So I think it's incumbent upon us to yield integrative solutions and to create an open door platform. In our attempt, at least our first attempt to do this in our office is the HHS Startup Day, or rather one of our attempts to do this is the HHS Startup Day. So my email is kevin.mctigue, MCTIGUE, @hhs.gov. Feel free to email me. We'll create some partnerships.
Great. So when is the next industry day?
Yeah, so our next HHS Startup Day will be held in Boston. It's March 30th.
Okay. Yeah. So I'm going to open up the floor for some audience questions. We have one audience question before I get yelled at here. Okay. Okay, Matt over here. Any questions? Steve Vito.
Can you give that email address again?
All right, here it goes. Yeah.
You're going to get bombarded.
So Kevin, KEVIN, .mctigue, MCTIGUE, @hhs.gov.
Don't spam him, please. Okay, let's see if there's another question. More question? Yes, sir.
There is, through Diox and other innovation storefronts, there is a procurement methodology called Other Transactions Authority, which allows very rapid use of streamlined procurement authorities. And, for example, Rain Technologies just was awarded a production OT contract out of Diox. Would that form of acquisition and procurement streamlining approach be useful to the civilian agencies like HHS?
I can jump at that if you.
So I would say I'm less familiar with that, but which authority was that?
OTA.
It's called OT or OTA, Other Transactions Authority.
So right. There are pockets of HHS, as you likely know, that have OTA. I believe NIH has it, BARDA has it, and one or two other places. And I don't think that it actually applies to all of NIH, but. I absolutely think that if there was a larger authority, or a larger group of agencies that had OTA, that it would absolutely make some of the acquisition process much easier.
We can take one more question. I'm allowed. Yeah. Well,
Nothing on data. That.
You have a chief data officer. Now is your chance. Yes, ma'am.
My name is Madeline. I'm with a small company that handles a lot of data for the Census Bureau. And I am curious what upcoming projects you do have or upcoming needs that you do have in terms of data, collecting data, data analysis.
So I would say we're not really looking at new data collection, right? A lot of the data collection activities that any department is engaged in, if you go back, start with some legislation that asks a department to collect information. And so a lot of the data collection activities have existed for 20, 30 years, which is great because you have great longitudinal data, but not so great if you have a question and there aren't any metrics that are getting collected around it and there isn't necessarily a method to start collecting. So I would say, we are looking at really linking data to priority areas like the opioid epidemic, and really linking it to use cases that we can start to demonstrate value from for leadership. So the opioid epidemic is going to be one. We're going to be looking for another use case to start to link data from across HHS. And we're going to be, again, as I said, looking for partnerships. So, reaching out to companies that collect data that might be interested in partnering with us, and unusual sources of data that we might not have access to as well.
Thank you. Thank you so much to Dr. Siddiqui and Kevin. I appreciate your insight. It's been really, really helpful. So give them a big round of applause.
Thank you.
Thank you.